I want you to imagine you are in a clothing store. You have picked out a nice outfit, maybe a shirt or a dress that looked great on the hanger. You go into the dressing room, you put it on, and you turn to the side to look in the three-way mirror. And that is when you see it. It stops you cold. You see a curvature at the base of your neck. It looks like a round, fatty lump sitting right where your neck meets your shoulders. It makes your head look like it is jutting forward. It makes you look older than you feel. It makes you look like your grandmother. You might instinctively try to stand up straighter, pulling your shoulders back, but the lump is still there. You might feel a wave of shame, or perhaps a fear that this is it, that this is the inevitable old lady posture that you have dreaded your whole life. You might have heard the terrible, outdated term for it, the Dowager's hump. It sounds permanent. It sounds like a sentence to a life of frailty. I am here to tell you that this hump is not a life sentence. It is not just fat that you are stuck with. It is a structural signal from your body that your spine is out of alignment, and more importantly, it is a condition that you can fight, improve, and often reverse. Today, we are going to have a very honest conversation about the anatomy of your neck. We are going to debunk the myth that this is just about weight gain. We are going to look at the role of osteoporosis and the modern plague of tech neck that is accelerating this condition in seniors. And most importantly, I am going to teach you a specific, powerful movement, the wall angel, that you can do in 2 minutes, without any equipment, to retrain your spine and reclaim your height. By the end of this video, you will understand that standing tall is not just about vanity, it is about opening your lungs, saving your balance, and projecting the confidence you deserve. To understand how to fix the hump, we first have to understand what it actually is. It is not a tumor. It is not a callus. In the medical world, we call this hyperkyphosis. It is an exaggerated forward curvature of the upper thoracic spine. But why does it look like a lump? Think of your spine as a stack of building blocks. When the blocks in your upper back start to collapse forward, the vertebrae at the base of your neck, specifically the C7 and T1 vertebrae, poke out. They protrude backward. Because the body is smart and wants to protect this bony protrusion from rubbing against your clothes or getting hurt, it lays down a protective layer of connective tissue and fat over the top of it. It creates a cushion. So, while it feels squishy like fat, the root cause is the bone pushing out underneath. You cannot diet away a bone problem. You have to fix the alignment. Why is this happening to you? There are 3 main culprits, and they often work together. The first is the bowling ball effect. Your head weighs about 10 to 12 pounds. That is the weight of a bowling ball. When your ears are stacked perfectly over your shoulders, your spine handles that weight effortlessly. But for every inch your head drifts forward, looking at a phone, reading a book, driving, or just slouching, the effective weight of your head doubles. If your head is 3 inches forward, which is common for many seniors, your neck muscles are trying to hold up 40 or 50 pounds of force all day long. The body adapts to this heavy load by building up extra tissue at the base of the neck to reinforce the hinge so your head doesn't snap off. The hump is literally your body trying to build a buttress to support your heavy head. The second culprit is osteoporosis. This is critical for the 60-plus demographic. As our bones lose density, the front part of the vertebrae can develop tiny, microscopic fractures. These are called compression fractures. Imagine a marshmallow that you squish on one side. It becomes a wedge shape. When the front of the vertebrae collapses into a wedge, the spine naturally tips forward. This creates that rounded, hunched-back look. The Dowager's hump name comes from this historical link to older, widowed women who often suffered from undiagnosed osteoporosis. But men get it too. It is a sign that the structural integrity of the front of the spine is failing. The third culprit is muscular imbalance, specifically a condition called upper crossed syndrome. This sounds technical, but it is very simple. It means the muscles on the front of your body, your chest and pectorals, are tight and short because we spend our lives with our arms in front of us, driving, typing, eating. Meanwhile, The muscles on the back of your body, the rhomboids and lower trapezius, are weak and stretched out. They are too weak to pull the shoulders back. The tight chest pulls you forward into a ball, and the weak back lets it happen. The hump is the result of this tug-of-war where the chest muscles are winning. Why is this dangerous? Why should you care other than for how you look in a dress? Because the hump is a health hazard. When your upper back curves forward, it compresses your rib cage. It physically limits how much your lungs can expand. Studies have shown that people with severe kyphosis have significantly reduced lung capacity. You might feel short of breath just walking to the mailbox, not because your heart is bad, but because your ribs are crushing your lungs. It also affects your digestion. The compression on the stomach can cause acid reflux and heartburn. And critically, it changes your center of gravity. When your head is forward, you are constantly falling forward. This dramatically increases your risk of a fall. And we know that for a senior, a fall is the #1 threat to independence. Fixing the hump is about fall prevention. So, is it permanent? If the cause is purely multiple wedge fractures from severe osteoporosis, the curvature might be structural and rigid. However, for the vast majority of people, there is a huge postural component that is flexible. Even if you have some bone changes, you can strengthen the muscles to lift the spine up, reducing the appearance of the hump and stopping it from getting worse. You can pull the bowling ball back over the center of gravity. Now, let's get to the solution. The fix. You don't need a gym. You don't need expensive braces, which often make your muscles weaker because they do the work for you. You need a wall. I am going to teach you the wall angel. This is the gold standard exercise for correcting forward head posture and upper back curvature. It is deceptive. It looks easy, but when you do it right, it is incredibly challenging. It forces your body into the exact opposite position of the hump. Here is how you do it. Find a blank wall in your house. A door works too, as long as it is closed securely. Step 1. Stand with your back to the wall. I want you to place your heels about 4 to 6 inches away from the baseboard. Do not try to put your heels touching the wall, as that will make you arch your lower back too much. Step 2. Lean back so your buttocks are touching the wall. Step 3. Touch your shoulder blades to the wall. This is key. Squeeze them together slightly and pin them to the surface. Step 4. This is the hard part. I want you to touch the back of your head to the wall. Now, listen carefully, do not just tilt your chin up to look at the ceiling to get your head back. That is cheating. You must keep your chin tucked. Imagine you are holding a tennis ball under your chin. Or imagine you are trying to make a double chin. Keep your eyes looking straight ahead at the horizon, and slide your head straight back until it touches the wall. You should feel a deep stretch in the back of your neck. If you have a large hump, you might not be able to touch the wall with your head yet without pain. That is okay. Get as close as you can. Put a small folded towel behind your head if you need a spacer. The goal is the effort of pulling back. Step 5. Now, the angel part. Raise your arms up to the sides like a cactus or a goalpost. Your elbows should be bent at 90 degrees, and your upper arms should be parallel to the floor. Try to touch your elbows and the backs of your hands to the wall. Many of you will find this impossible at first. Your hands will want to pop off the wall. Your ribs will want to flare out. This shows you how tight your chest is. Fight to keep the backs of your hands against the wall. Step 6. The movement. While keeping your butt, shoulders, head, elbows, and hands touching the wall, slowly slide your arms straight up toward the ceiling. Like you are making a snow angel in slow motion. Go as high as you can without any part of your body peeling off the wall. Then, slowly slide them back down to the cactus position. Squeeze your shoulder blades down and back as you lower your arms. Do this for 10 repetitions. It should take about 2 minutes. What are you feeling? You should feel a burning sensation in the muscles between your shoulder blades. That is your weak rhomboids waking up. You might feel a stretch across your chest. You might feel your neck working hard. This is the feeling of realignment. You are literally prying your chest open and strengthening the muscles that hold you upright. If you do this every single morning and every single evening while you brush your teeth, you will see a change. You will notice that when you step away from the wall, you feel taller. You feel lighter. Your head feels like it is floating rather than hanging. But the wall angel is just the exercise. We need to talk about the lifestyle habits that are feeding the hump. The biggest enemy is the phone slouch. Look at how you are holding your device right now. Is it in your lap? Is your head hanging down looking at it? You are feeding the hump. Every minute you spend looking down is a vote for the hump. You need to develop T-Rex arms. When you look at your phone, tuck your elbows into your ribs and bring the phone up to eye level. Yes, it looks a little silly. It looks like you are taking a picture. But who cares? Your spine cares. By bringing the screen to your eyes instead of your eyes to the screen, you save your neck from that 50 pounds of pressure. Do this when you read books too. Put a pillow on your lap to prop the book up higher. Stop looking down. We also need to revisit the pillow conversation. If you are sleeping on 2 or 3 fluffy pillows, you are creating the hump while you sleep. You are keeping your neck in a permanent forward flexed position for 8 hours a night. You are molding your spine into that shape. You need to lower your pillow. Ideally, you want a pillow that keeps your neck neutral. If you sleep on your back, you might need a very thin pillow. If you sleep on your side, you need a pillow that just fills the gap between your shoulder and ear. But you definitely do not want a stack of pillows that pushes your chin to your chest. That is a recipe for disaster. Let's talk about the fat component. While the hump is structural, there is a pad of fat there. Fat accumulates there because of high cortisol, stress hormones, and insulin resistance. It is often a stubborn area for fat storage. However, you cannot spot reduce fat. Doing neck exercises won't burn the fat off the neck. But, improving your posture stretches the skin and muscle, making the lump look significantly smaller. And as you fix your diet to lower inflammation and lose overall body weight, that pad will shrink. But the bone alignment is the priority. I want to address the pain. Many people with this hump have chronic headaches. These are tension headaches, caused by the suboccipital muscles at the base of the skull being tight. When your head is forward, these muscles are clamped down to keep you looking up. They squeeze the nerves. By doing the wall angel and the chin tucks, you release these muscles. Many patients find that their chronic migraines disappear once they fix their head posture. The hump was the cause of the headache all along. There is another stretch I want you to add to your routine if the wall angel is too hard at first. It is the doorway stretch. Stand in an open doorway. Place your forearms on the doorframe, one on each side, with your elbows at shoulder height. Step 1 foot through the doorway and gently lean your body weight forward. You will feel a massive stretch across your chest and the front of your shoulders. This attacks the tight chest part of the equation. If you loosen the chest, the back muscles have an easier job pulling you straight. Do this every time you walk through a specific door in your house. Make it a trigger habit. We also have to talk about osteoporosis management. If you have the hump, you need to protect your bones from getting worse. You need calcium and vitamin D, of course. But you also need impact and load. Bones only get stronger if you stress them. Walking is good. But lifting weights, even light weights, is better. When you pull a resistance band or lift a grocery bag, the muscles pull on the bone, stimulating the bone to harden. If you have been diagnosed with osteoporosis, talk to your doctor about medication, but do not neglect the mechanical work. You have to use the bones to save them. Let's talk about the psychological impact of posture. There is a deep connection between how we stand and how we feel. When you are hunched over, protecting your chest, your brain interprets this as a signal of submission, fear, and depression. It is a defensive posture. When you stand tall, chest open, head up, your brain interprets this as confidence, power, and alertness. It affects your serotonin levels. By fixing your hump, you are not just looking better, you are telling your brain that you are engaged with the world, not hiding from it. People treat you differently when you stand tall. You command more respect. You feel more capable. I want to set realistic expectations. If you have had this hump for 20 years, it will not vanish in 2 days. It took decades to form, give it months to heal. But you will feel the difference immediately. You will feel the relief in your neck tension. You will breathe deeper. And visually, simply by standing with your ears over your shoulders, you can make the hump look 50% smaller instantly. It is about how you carry yourself. Let's recap the daily routine to banish the hump. Morning, do the doorway stretch on your way out of the bedroom. Open the chest. The fix, do 2 minutes of wall angels. Fight for that contact with the wall. Tuck the chin. The habit, check your phone height. T-Rex arms. Bring it up. The night, check your pillow. 1 pillow, not 2. The mindset, imagine a string pulling the top of your head to the ceiling. Be a puppet being pulled straight. Do not accept the Dowager's hump as your destiny. It is a sign of a system under stress. Relieve the stress. Realign the blocks. You have the power to change the shape of your body, even at 60, 70, or 80. The spine is resilient. Muscles are responsive. I want you to go back to that imaginary mirror in the clothing store. Imagine putting on that shirt. But this time, you stand differently. Your neck is long. Your shoulders are back. The fabric falls smoothly over your back because the lump is gone or significantly reduced. You look at yourself and you see vitality. You see strength. You don't see your grandmother, you see the best version of yourself. This is possible. It starts with the wall. It starts with 2 minutes. Go find a wall right now and see how tight you really are. And then, begin the work of opening up. Your lungs, your neck, and your spirit will thank you. Stand tall.